Hello, I'm Susan Webb, Director of Public Health for NHS Grampian. Last week, the First Minister announced the route map for easing restrictions as we learn to live with COVID-19 over the longer term. It is a measured de-escalation and is supported by a nationwide public health effort to test for COVID in the community and to isolate the close contacts of positive cases. In the announcement, she asked people to become familiar with Test and Protect service. So today, I want to share more information with you about how NHS Grampian is delivering Test and Protect. I must stress that Test and Protect is not a substitute for the measures that remain in place, such as physical distancing, good hygiene practice, including thorough hand washing, frequently cleaning used surfaces and objects, and using a tissue when you cough or sneeze. Test and Protect is one way for all of us to manage the spread of COVID-19 by breaking the chain of transmission. I'd like to break down what I'm about to share into two parts: information for people with symptoms and information for people asked to isolate. Firstly, those who have symptoms. If you experience any of the symptoms of COVID-19, which is a new cough, a fever, and/or the loss or change to your sense of smell or taste, you should call NHS 24 on 0800 028 2816 to request a test. You must do this as soon as you start experiencing symptoms. Don't wait to see if you get better. Now, if you are a member of health and social care staff or symptomatic household members of those workers, you should continue to access the staff testing service in Forester Hill, Elgin and Huntly. For further information, visit the staff testing section of the NHS Grampian COVID-19 website. For everyone else, the first point of referral for a test is at Aberdeen Airport. However, if you cannot reach this testing site, tell NHS 24 and they will refer you to the NHS Grampian COVID Hub, who can arrange then a test in Aberdeen, Elgin or Huntly. You can also book a test via the NHS Inform website, but be aware this doesn't offer the option to request your test other than at Aberdeen Airport. I'm giving you this detailed information so that you can access a test as easily as possible. The test itself involves taking a throat swab and a nasal swab. It is quick and, although it may be a little uncomfortable, it isn't painful. Results should generally be available within 24 to 48 hours, though this can vary depending on the number of tests performed. You will be contacted directly to confirm your result. While you are waiting for your test result, you and any members of your household must not leave your home for any reason. The person with symptoms should start 7 days of isolation, and people who you live with should prepare to isolate for up to 14 days. If you have a not detected or negative result, you and your household can end your isolation. If your test result is detected or positive, the person with symptoms will have to complete their 7 days of isolation. This should start on the same day you display symptoms or from the day your test was taken if you are unsure of when your symptoms started. Anyone living with you will have to complete 14 days of isolation, again starting on the same day you develop symptoms or from the day you are tested if you are unsure of when it started. If any of them start to display symptoms, they too will be tested, and so on. So now let me explain about our local tracing team. If you have a positive test, they will contact you to collect information about who you've spent time with, so they can assess who your close contacts are. A close contact is someone who's been physically close enough to you for a long enough period of time that they may have had the virus transmitted to them. The risk of the virus being transmitted is higher the closer the contact and the longer it has been. You can minimise the number of contacts you have by staying at home as much as possible and practising physical distancing. You could also consider keeping a daily note of who you met, where and for how long. The more information you can give the local tracing team, the better. The team then decide who is a close contact and who needs to isolate. They will then contact them and give advice accordingly. You don't have to get in touch with contacts or to answer any questions your contacts may have for you. But if they are people you know well, you can certainly speak to them. That decision rests with you. The local tracing team will ask your permission to tell your contacts who they've been in contact with. But if you do not want to give your permission for this, your contacts will not be given your identity. If you are asked to isolate, it is important to realise that this is not the same as social physical distancing. If you are isolating, you must not leave your home. So please make plans now in case you're asked to do this. If you are isolating as the contact of a confirmed case, but no one else in your household has been asked to do so, then they are still able to shop for groceries, pick up prescriptions, and so on. However, it's really important that they maintain the rules on physical distancing while doing so and keep these trips as infrequent as possible. If you do not have this kind of support close by, then the Grampian Assistance Hub can help. You can contact the Hub via the website below or by telephone on 0808 196 3384. This is a free phone service with lines open from 8 a.m. to 6, Monday to Friday, or 10 a.m. to 2 p.m. weekends. So as we work hard to test and protect, we ask you to continue playing your part in disrupting the spread of the virus. And thank you for the resolve you've shown in the past few months. More details about NHS Grampians Test and Protect service is available at the website below.